Hello, everybody. Dr. Julie McLaughlin here for Empowering Women by Cairo Secure. I am super excited you joined me today because you are going to learn about the top 10 blood tests to reverse and prevent chronic disease. So let's get started. I have a few slides to show you, and hopefully you're going to take away some really good information about lab tests and chronic disease and the things that we can do. But first, let's thank Cairo Secure. Let's give them lots of hearts, thumbs up, love, because they are an amazing, amazing company. They make sure we are all safe with our insurance, and they have sponsored all of these shows and all these events to really bring more information and education to our profession. So we love Cairo Secure, so thank you so much. So let's get started on these blood tests. So we're going to talk about maybe the top 6 preventable chronic diseases. So talk about heart disease, gut problems, adrenal fatigue, energy, everybody's all tired, arthritis, degeneration, anemias and deficiencies, and diabetes. So these are the big ones that we can really easily test for when we're looking at lab work with our patients. And if you're just starting out with functional medicine, or even if you're just thinking about adding it to your practice, this is going to give you an overview of why you would even want to consider this and what some of the tests look like. So I'm going to go through the tests and tell you what they are, and then we'll make a little bit deeper dive into each one. So we're going to look at a cholesterol panel. We're going to look at an advanced cholesterol panel. Hopefully you've heard of that before, but we're going to talk about that. We're going to look at inflammation markers, blood sugar panel, the vitamin B panel. Number 6 is going to be the liver enzymes. 7 is going to be CBC, deficiency panel we're going to look at, essential fatty acids, and genetics. So those are our top 10 lab tests that we look at to really hone in to make a difference in these chronic diseases. So the first one is the lipid panel. And I want to tell you, this lipid panel is 50 years old. Isn't it crazy? I don't know about you, but I wouldn't test my dog with something that's 50 years old. So that's why we want to have the advanced lipid panel in addition to this lipid panel. So the lipid panel is going to really monitor the amount of plaque being laid down in your arteries and how much is getting cleaned up. And it's going to help us determine your cardiovascular risk. And there's so many lifestyle things, nutrition that we can do to absolutely make sure that you have the best cholesterol and triglycerides possible. So you look at total cholesterol, which is really just a math problem, right? It's just the HDL, the good cholesterol, plus the LDL, plus another little one called VLDL. And you literally add those numbers together and it equals a total. So that's why we always want to look at ratios on these. That's going to give us the best information. Triglycerides, which are fat plus a sugar, that is sticky, and that's what causes our plaque to stick in our arteries. And so sugar is going to elevate this. Alcohol is going to elevate this. So changing your lifestyle is going to make a big difference on these. And you'll see on some of these ranges that I have on the slides, they're a little different than you'll see on a traditional lab test because these are functional medicine ranges. So we want your triglycerides below 115. The labs will say 150. And we want your HDLs for men above 50 and for women above 60, where the labs will say above 40. So we really want to put you in the healthiest range to make sure you're not getting any of these disease. And again, we're not using things that are 50 years old, so we have to up our game and do some more advanced lipid testing. So these are a couple of advanced lipid tests. The ApoB tells us how sticky the bad cholesterol is. So that goes with the LDL. The SDLDL, I call it super dangerous LDL. That again tells us about LDL, but it tells us about the size. So if the size is small, it's more likely to plaque up your arteries, where if it's big, it's easier to clean up and it's not going to be a problem. And then ApoA1, this tells us about the quality or how hard your good cholesterol, your HDL works. There's a few other little advanced blood markers like LP little a that we look at and a couple others. But for the most part, if you're looking at these along with the lipid panel, you're going to have a good overall risk ratio for patients. One of the ratios that we look at is a ratio between the ApoB and the ApoA1. And this gives us our highest predictor of a future coronary event, which when you're looking at prevention, we can work on things to reverse these. And we do it all the time with our functional medicine patients, and we see changes in as little as 3 months. Okay, so inflammation. We know inflammation is really the upstream problem for all these downstream diseases like high cholesterol, diabetes, arthritis. So we measure inflammation. The highly sensitive or HSCRP is a marker that measures cardiac risk. So CRP is going to measure just overall inflammation. But if you have elevated HSCRP, you know that you're going to be causing heart disease and plaque. And let's face it, heart disease is our number one killer. And so we really want to make sure that we put this inflammation to rest because we don't want to get those downstream diseases. Okay, the metabolic panel. We definitely have a crisis in this country with this, with diabetes, prediabetes, insulin resistance, metabolic syndrome, you name it. And most of the time when patients are going to get their blood test, they're just getting their glucose test. And you know that varies. You could get your glucose tested 20 times a day and you get 20 different numbers based on your exercise or what you're eating or what you're not eating or intermittent fasting. Whatever you're doing, that glucose is going to be all over the place. So when we look at our patients, we want to get a really good measurement. We want to look at the hemoglobin A1C, which is actually a 3-month blood marker. By looking at them for 3 months, it's going to give us a much more look at what we can do to change it. Insulin. Insulin is a fat fertilizer. When their insulin's going up, they could have high insulin and normal glucose and normal hemoglobin A1C because they're in that pre-diabetic mode or that insulin resistant mode. They can't lose weight, they're gaining weight, and they will easily flip into diabetes. So you always want to measure that. And the last one is HOMA-IR. And this is actually a calculation between the glucose and the insulin. And it's a predictor for diabetes. So these tests are really, really important if you're ordering some panels to take a look at. Now, let's talk about some deficiencies and anemias. We know B12, folic acid. We see patients with this a lot, with neuropathy, with all kinds of problems with the nervous system. So it's super, super important to test these. And in a few minutes, I'm going to talk about one of the genes that affects that folic acid. So sometimes people think that they're taking vitamins over the counter and that they're getting plenty of vitamins and maybe they're even eating decently. But if they don't have the right form because of their genetics, they're not going to be able to absorb it. So you absolutely want to test this. Your liver enzymes. So the liver enzymes are part of a chem screen. So when you order a chem screen, you're going to get these liver enzymes, and it's going to tell us if your liver is overactive, maybe it's inflamed, or underactive, like a fatty liver, right? Because these cause problems with cholesterol and digestion and detoxification. And God forbid, knock on wood, you didn't get cancer, right? So alkaline phos, that measures cell growth proliferation, specifically in the bone and the liver. So we want to really make sure that we're looking at these liver enzymes because it's going to tell us about more organs in our system than just our liver. CBC, complete blood count. So this complete blood count, it measures our white blood cells for our immune system. And included in that is going to be our platelets, right? And it's going to be all the individual types of white blood cells, like the monocytes, the lymphocytes, the, basophils, all of those different things are in that white blood cells. So you can tell if someone has bacterial infection, a viral infection, are they having allergies? What is it that's affecting their immune? The red blood count, that's going to be really important for the iron and the B vitamins, for the anemias. And the hemoglobin and hematocrit, that's going to be the oxygen carrying component of the blood and affects the iron. That's going to be super important to look for anemias. People who have maybe a bleeding ulcer or they have some kind of GI bleed, or maybe women having heavy periods, you're going to pick this up. Or people eating a very poor diet where they're not getting enough nutrients and they're anemic. And we know we show up in our office, and this is the thing, as a chiropractor, I never want somebody to say the chiropractic doesn't work. And they go through the treatments and they're just not getting better. There's got to be a deeper answer. And so if they're anemic, if they're having some of these deficiencies, you got to look at it because it's going to We had a little technical difficulty. We had a little problem there. So we're back, though. Thank you for staying with us. Computers, you got to love them, right? So we were just talking about deficiencies. And with the B12 and folic acid, now we're going to talk about vitamin D, CoQ10, and magnesium. So vitamin D is super, super important for musculoskeletal system, your brain, your heart, your immune system, so many things. And, you know, people finally during COVID started to wake up to see how important vitamin D is. We've been testing on our patients for close to 20 years, and we like our ranges to be between 60 and 80. So it's super, super important to have plenty of vitamin D. But people will just take vitamin D and not know how much they need. And they're just guessing. And you can take too much, just like you can take too little. So you need to test it and know where you are and dose appropriately. CoQ10, it's great for heart and anti-aging and fertility and gives us good energy. We want to take a look at that. It's good for patients who are taking statins. God forbid they have musculoskeletal aches and pains from taking statins. A CoQ10 can offset that side effect. Magnesium is super important for our brain, our nervous system, our muscle, our heart. There's all different types of magnesium, but you can measure it in the blood to see if that patient's having adequate. And I can tell you just from doing thousands and thousands of blood tests, everybody I test, if they're not eating an adequate, healthy diet, if they're not taking quality supplements, they're deficient in these things, and you see them. All right, so how about essential fatty acids? Like, did you know that you can measure your essential fatty acids? You can measure your omega 3s and your EPA and DHA, the parts of the omega 3s, as well as the monounsaturated fats and the ALA, the good fats, to see which one you need more. So people who have a LDL, a bad cholesterol problem, they need more EPA of the omega 3s, and they don't need the DHA. The DHA we use a lot with kids with brain function, things like that. But how are you going to know? How are you going to know what to dose? How you know what to give somebody unless you're checking? So what measures get managed. So you want to know the numbers. All right. So on the next one is genetics, right? So there's two tests that we test. And, we have millions of genes, but we only test the ones that we can really make a difference in, and it can change that affect these chronic diseases. One's called MTHFR, and it's methyl tetrahydrofolate reductase. And this one controls methylation, and it helps us convert folic acid to folate. And so even if somebody is taking a supplement that has folic acid in it, if they have this enzyme or this gene that they can't convert it, they're not going to be able to utilize it. And their homocysteine, another blood level, is going to elevate. And that can cause a heart attack, not linked to lipids. So it's super important. This MTHFR affects the brain, it affects the heart, it can affect clotting, it can affect memory, so many things, but it's super easy to fix by doing a methylated quad folate, but first by knowing if they have it or not. Now, ApoE, this tells us about risk for heart disease and Alzheimer's and diabetes. And it helps us with nutrigenomics on how to eat, right? So there's three different types. I'll just give you a quick overview. We have other seminars that we do where we go way deep into this. So there's a 3, there's a 4, and there's a 2. These are the most common types. There's a couple little small variants that are super rare, but for the most part, these are the common types. So 65% of the population are 3s, and I call them bears. And the reason is they're not hardwired with this one gene to get diabetes or Alzheimer's or to get diabetes. So when we look at them, we want them to eat kind of like an omnivore, where they're going to have balance between protein, fats, and complex carbohydrates. Now, people who have a 3-4 in this ApoE gene, they're going to be more susceptible to heart disease. So I call them a deer because they need to eat more plant-based. So if you have more heart disease, if you have Alzheimer's in your family, plant-based is going to be the way to go. Now, only 10% of the population are tigers, are a 2-3. And so they're going to be more susceptible to diabetes. They're going to need a higher quantity of protein and fats and less complex carbohydrates. And there's so many trends in diets all the time from every different thing you name. And, someone reads a book, but how do you know what you really need? I have some friends who were eating keto and doing all kinds of crazy things and ended up that they were a deer and got some heart disease and some pretty bad stuff. So we want to make sure that you're eating for your genes. So the MTHFR that we talked about is linked to 40 different diseases, and 30% of the population have 2 of these genes, which makes it a significant finding. And 40% have 1 gene. So 70% of the population has this. Do you agree we should be testing for this? And it's super simple to do with nutrition and lifestyle. So we definitely want to make sure, because it affects their nervous system. As chiropractors, that's what we care about. So there's a dangerous belief that nothing can be done, right? Oh, there's nothing you can do about it. We hear it all the time. But I'm here to tell you that's wrong, because there's absolutely, if you measure these things and you find out what it is that each individual needs, you can make the changes and you can educate them to be able to make those changes. So that's it for today. If you want to learn more, I'm Dr. Julie McLaughlin from Vital Health Protocols. And you can see our site at onlinevhp.com. And of course, we have to thank ChiroSecure because they are just awesome. So thank you so much. And we'll see you next time on Empowering Women.
Join us each week as we bring you the best in business growth, practice management, social media marketing, networking, leadership, and lots more. If it's about women in practice and business, you'll hear it here. We hope you enjoyed this week's Facebook Live event. Please like us on Facebook, comment, and share. We look forward to seeing all of you next week for another episode of Empowering Women in Chiropractic. Now, go ahead and hit the share button and tell your friends and colleagues about the show. Thank you for watching. Have a beautiful day. This has been a ChiroSecure production.